This is going to be about GI. Very, very quick summary of maybe, in my opinion, what's important. GERD, treatment PPIs for 8 weeks. First line, second PPI low dose. You also use antacids if needed, H2 antagonists, and of course PPIs. All right, PPIs, they ends with prozol. Side effects, headache, nausea, diarrhea. Adverse reactions, a high risk for C. diff, osteoporosis, bone fractures, decreasing in magnesium, B12, calcium, iron, and also very high risk for cardiovascular events with Plavix. So you also need to taper off with PPIs. The antacids, that's a calcium carbonates, everyone knows as TAMS, milk magnesia, aluminum hydrate. Not with other meds, don't give with other meds, of course. We have to be cautious with renal and because lots of interactions, especially like quinolones and tetracyclines. Um, H2 antagonists, antihistamines, and that will be famotidine and ranitidine. Side effects, headache, renal, and hepatic, whatever. Uh, my words leaving me. Anyway, you have to avoid cimetidine because of the increase of interactions and side effects. This drug is usually not used anymore. So that will be with GERD. Moving on to PUD, peptic ulcer disease. It is also treated by PPIs, which end with prozol, taper off, side effect headache, nausea, and diarrhea. Um, adverse reaction, increased risk for C. diff, osteoporosis, decreased magnesium, B12, calcium, and iron, bone fractures, and CV events with Plavix. So PUD can be caused by H. pylori, NSAIDs induced, or stress. It is diagnosed by breath, sputum, or biopsy. You have a gastric ulcer if you have food in your mouth and you have pain. If you have pain and then eat and it feels better, that's duodenal ulcer. With PUD caused by H. pylori, you will use either triple or quadruple therapy. Triple is PPI, amoxi, and clarithromycin. If you have an allergic reaction to amoxicillin, then you use flagyl. H. pylori with quadruple, that will be PPI, bismuth, flagyl, and tetracyclines. Both of them at least 10. Triple is therapy is 14 days, and quadruple is from 10 to 14 days. With PUD, you also might use cytoprotective drugs. So misoprostol, very important to know, is black box warning about that it can abort your baby if you are pregnant. So don't use with pregnant. And sucralfate, you have to cautious with renal and separate 2 to 4 hours from meds. Side effects of constipation. Gastroparesis would be no cure. It's a slow moving of guts. Risk factors, diabetes, abdominal surgeries, low thyroid, or Parkinson's. They use prokinetic agents such as metoclopramide, Reglan. Side effects, EPS, increased aldosterone, drowsiness, depression. So you do not give that. It's contraindicated with Parkinson's or mechanical obstruction. Another prokinetic agent can be actually erythromycin. Side effect is QT prolongation, and it has a lot of interactions. Next is IBS. IBS treated normal IBS that goes with diarrhea and constipation um, intermittently is diclofenac, that's a bentyl. Side effects: dry mouth, dizziness, and nausea. With constipated IBS, linaclotide and lubiprostone. Linaclotide is avoiding with peds and dehydration. If you have nausea, take with foods. And IBS with diarrhea, you use allocetrone. Adverse reaction is ischemic colitis, um, and the rifaximin common relapse. You also can use antidepressants and anti-anxiety and CBT to help with IBS emotional state. Now we're going to briefly talk about nausea, vomiting, constipation, and diarrhea. Nausea and vomiting can be treated with antihistamines. It's a dry, so no Benadryl for old people. So you need to give second generation like Claritin for them. Cautious with glaucoma, BPH, and old people antihistamines. That will be for the nausea, as well as 5-HT3 receptor antagonist, like a Zofran. That will be side effect of increased QT. Um, for vomiting, you would use um, phenothiazines, like Phenergan. Side effect will be IV extrication and absolutely contraindicated in narrow angle glaucoma, Parkinson's, hepatic disease, severe cardiovascular, and depressed bone marrow. Nausea and vomiting together can be treated for chemo patients by cannabinoids. We need to be careful with side effects and blood pressure low. Corticosteroids or benzodiazepines. Benzodiazepines have a sedation and decrease CNS, so very high risk for fall in old people. Constipation, diarrhea. Constipation. You have bulk forming, which is increasing peristaltis. You have to take with water. Example, Metamucil. Asthmatic. Increased movements. Monitor electrolytes. Example, Miralax. Emollients. Stool softener for prevention. Example, Calais. Lubricants. Stool softener. Avoiding old patients. Aspiration risk. Mineral or oil as example. Stimulants, increase motility, side effects cramping, Senna and Dulcolax. Saline-based, increased pressure motility, example of magnesium citrate or milk of magnesium. You have to avoid with renal patients with magnesium. And the sodium phosphate you have to avoid with CHF patients. Diarrhea. First, life changes. Second, brat diet, banana rice, applesauce, and toast. Bismuth subsalicylate. Avoid in kids because of Reye syndrome and aspirin allergy. You have to remember that bismuth, that's Pepto Bismol, in adults is a liquid and in kids is a tablet. Loperamide, Imodium, that is synthetic opioid only for NGI and used as for travel diarrhea. Diphenoxylate atropine, Lamotil, that is controlled substance and needs to be monitored for that. To be prescribed. Antibiotics for diarrhea, if it's dysentery, like blood and fever, you give, but you do not give antidiarrheal for blood or fever. And that is all about GI.